Hey, Dr. Shakib here from Irvine Spinal Wellness Center, your Irvine chiropractor, talking about 7-month pose, which is essential for the health of your back, your neck, all of your joints, and more. So stay tuned. All right, let's talk about 7-month pose. This is what we all did when we were 7 months old. And this is the quadruped or tabletop, like that. There's certain criteria that I'm gonna borrow Desiree so I can point them out. So Desiree, come on over and so there are different steps and different things you need to do before you get to it. We're not going to be going over that. Those are other videos you can check out. All the best reasons why you should be subscribing to my YouTube channel. Go into the 7-month pose. So 7-month pose is not meant to be for you to be just on your hands and knees. There are a lot of different things to keep in mind. Number one is you engage your barrel. I've done a video on that. Check it out. So the next thing is you want to make sure that your wrist is stacked right below your shoulder and your knee is stacked right below your hip. Your knees, therefore, are as wide apart as your pelvis. Your feet are nice and flat and against the floor. Desiree, give us the wrong one, the wrong neck. So typically people go like that. What you want to do is you want to glide your neck up and you want to spread your fingers so everything is nice and wide and you're not over your wrist. So you want to be, chances are you've got wrist issues in doing this, so be behind it. Therefore, move your knees back a little bit more to make sure that it's stacked right under your hips. And then what you want to do is you want to make sure your upper trap is not engaged and you push your chest up as if there's like I'm over here and I'm sucking the whole spine up. So glide your neck up and push this up and push into the ground to activate your triceps. You want to make sure you're not dipped in. This is a dipped in, so she's trying to show you the thing. So Desiree, there is a little bit of a dip here. I wish for it to not be. This may be something we need to work on. So your shoulder joints, your upper trap needs to be externally rotated. So you want to move this up, push your shoulder blades towards your back pocket and glide the neck up and push this part of the back up towards the ceiling. You want to engage your barrel and this looks great. Holding this pose, and then we're going to keep the tabletop as is, and we're just going to push into the ground and into the pelvic, breathe into the pelvic floor. These are all other videos that we're doing to go backwards, go back, back, back. Right now, Desiree, drop this a little bit. Desiree, bring this up a tiny bit more right there and push this up and go all the way back. As you go all the way back, you want to make sure your scapular shoulder blades are pushed down as you're pressing into the ground. The triceps is continuously active by making sure your scapula are going towards your back pocket. You're keeping the shoulder socket in place as you're elongating and you're really opening up this ball and socket joint. Pull this down, glide your neck up, and now when it's time to go, still go ahead and press into the ground and push up and keep this nice, and she did a great job there. Push this up and you go back and forth. Thank you. I get out of breath with other people doing their exercise, and that's silly. So give us a feedback. Was it hard? Was it easy? Was it like, yeah, más o menos?
It's challenging.
It is challenging when you make sure all the right muscles are doing their main job. especially when you're not used to doing this, it's a challenge. It seems a lot easier. It's easy to mechanically duplicate this.
It's easy to do it wrong.
And it's easy to do it wrong.
I do it at home. It doesn't feel like it felt right now.
Really?
Yeah.
So that's, I guess, one of the reasons why people need to be doing it here. So don't worry about getting it right that first time. It really, I mean, if you think about it, you didn't start walking the moment you thought, oh, I want to go get that toy off the shelf. It's an attempt, multiple attempt, which comes with a lot of intelligence behind it. A lot of neural development depends on that, and a lot of conditioning of the muscles comes with that. So do your very best, pay close attention to the details. You don't need to have all of them in place the first time, but making sure you do this correctly is a better attempt and gets you closer to where you need to be compared to you just not doing it, period. Anyway, I hope you got something out of this. Make sure you subscribe to my YouTube channel, check out my website, and also my podcast, Life and Health Matters with Dr. Shakib. All the information is in the description box, and I really hope you're going to take advantage of what's provided to you to make a huge change for better. Thanks for watching. Take care.